Recent criminal prosecutions and continued allegations of fraud in the state of Minnesota's Medicaid and other benefit programs have shown a spotlight on how vulnerable these programs are. Americans are outraged. Any amount of waste, fraud, or abuse of resources and taxpayer funds is too much, but it's particularly alarming when it happens on a scale as large as what's being uncovered in Minnesota. What's happening in Minnesota's Medicaid program is critical and worth discussing, but it is just the tip of the iceberg. Medicare and Medicaid fraud is common. It's happening nationwide, and it has been egregious for decades. Some estimates place annual Medicare and Medicaid fraud losses at $100 billion annually. This is only a conservative estimate because fraud can only be accounted for if it's detected. The Government Accountability Office placed Medicare on its inaugural high-risk list in 1990, and it's remained there ever since. Medicaid has also joined Medicare on the high-risk list in 2003. The Department of Health and Human Services Office of the Inspector General has also sounded the alarm on the unsustainable rate of waste, fraud, and abuse. We have to adjust and address this issue. Here are just some of the examples of the fraud schemes that we are seeing today in these programs. In New York, an adult daycare owner defrauded Medicaid over $68 million through illegal patient referral kickbacks and bribery schemes. In Arizona, a man based in Pakistan and United Arab Emirates allegedly billed Arizona Medicaid $650 million in a fraud scheme targeting the homeless and Native Americans seeking substance abuse treatment. In another case last year, 7 defendants across Arizona and Nevada were charged in connection with an alleged $1.1 billion Medicare fraud scheme for medically unnecessary amniotic wound allografts, commonly known as skin substitutes. And just a few weeks ago, a Florida laboratory owner pleaded guilty to a $52 million in medically unnecessary genetic tests billed on behalf of Medicare beneficiaries. In all of these cases, patients suffer from unnecessary, inadequate, or a complete lack of medical care. In other cases, patients are unknowingly victims of identity theft or misleading marketing practices perpetrated by these fraudsters. And as highlighted in one of the above examples, nation-states and overseas criminal gangs are also targeting Medicare and Medicaid. Recent medical criminal indictments and convictions show the trend is getting worse and exemplify the scale of the fraud. It has been said that healthcare fraud is becoming easier and more lucrative than the illicit drug trade. Patients will suffer if these healthcare programs cannot continue on responsible fiscal paths. It is our duty in Congress to protect these programs for our most vulnerable Americans. American taxpayers place hundreds of billions of dollars into Medicare and Medicaid. We must do better to protect these programs from fraud that is draining them of billions of dollars annually. We applaud law enforcement efforts that investigate fraud and prosecute fraud, but we can save more money by detecting and preventing fraud before it even occurs, rather than paying and chasing funds after they have already been dispensed to the criminals. The increased focus on this subject from Dr. Oz, the administrator of CMS, has also been an important improvement over the previous administration.